Hello friends, welcome back to the second part of video where we were discussing about approach to obstetrics, where in last video we studied something related to statistics part of it so that we know what are the cases which we're gonna see. Now coming to this video, here we will discuss how with pre and paraclinical subject you can extrapolate obstetrics. Okay, coming to the point, not wasting further time. See, whenever you are studying a subject, as we have discussed in earlier class, we will divide this into basic, pre and paraclinical subjects. So now coming to the anat part of it, physio part of it and patho part of it. See, what are the things which are important in anat? See, pregnancy is something which constitute three life, that is father, mother and fetus. Okay, see, for proper well-being of fetus, the basic structure of the hormone balance is something which is very important, and for that, which this is something which influences the uterus, which further influences the attachment of fetus in the uterus, which further helps in attachment of placenta as well as umbilical cord. So if you see, what are the structures now? One is the HPO axis, which we will see. Second one is the uterus. Okay, then what do you think is there in uterus? Yes, this is fetus, this is placenta, and this is what? Umbilical cord. Correct? No, see, as such, this is like, okay, now what are the things? The mother needs to supply oxygen and carry the excretion. For that, what is required? Blood vessels. So you can see these are the blood vessels which are there, right? Blood vessels. So understanding the anatomy of fetus, understanding the anatomy of placenta, understanding the anatomy of umbilical cord as well as blood vessels is something which is very important. See students, when it comes to MD subject, physiology is something which dominates, and when it comes to MS, it's anatomy which dominates. This influence with endocrine, for example insulin, for example thyroid. Okay, insulin and thyroid is something which further influence the attachment of fetus in the uterus with the components of placenta and umbilical cord. This is something which you know. Now, what do you think can be the problems? If coming to blood vessels, which are easy, if they're in the blood vessels, if you think if there is less blood or less hemoglobin, what does it cause? Yes, you are absolutely right. That is anemia. Okay, if there is high resistance in the blood vessels with respect to placenta, then it causes PIH, that is pregnancy induced hypertension. And if it causes an hyperdynamic state, or if a mother is a known case of heart diseases, then heart related issues like MS or MR is something which is common. Correct? See how we are gonna extrapolate. If you stay with me for entire video, I'm sure you will know what are the things which happens in ops. Okay, this is something to do with blood vessels. Now coming to umbilical cord. See, umbilical cord can either get attached properly, that is to the central, that is if this is placenta, if here it gets attached, it's proper. But if it get attached laterally, then lateral insertion of umbilical cord, which has its own complications, which we'll discuss in subsequent videos. Or if it get attached to the lateral with a Wharton's jelly, then it causes velamentous insertion, which also has further consequences, which we'll discuss in the next subsequent videos. And based on placenta, what do you think are the anomalies? Placenta should get attached to endometrium. If it get attached to myometrium, then it has its own consequences, like placenta accreta spectrum. Yes, I meant spectrum in subsequent videos. We'll talk individually about placenta accreta, placenta increta and placenta procreta. And if placenta is attached here, okay, this is normal. What if placenta gets attached here? That is called as what? Vasa previa. Yeah, that is called vasa previa, which is diagnosed after a specific week, which we'll discuss. Okay, now related to placenta anatomy, you are done. Umbilical cord done, blood vessels done. Now coming to fetus. So what do you think with relation to fetus we can derive something related to anatomy? Yes, based on where it gets attached. Okay, so you can have ectopic pregnancies if it gets attached anything away from the normal structure, that is normal uterus endometrium. Okay, now also what is important is I talked about insulin, thyroid, right? If this is not functioning properly, then again it will cause problems. So what do you think pregnancy is? Pregnancy is an hyperthyroid stage. Why? Because fetus cannot produce its own T3 T4, so mother should provide a thyroid hormone to her. So if there is a suspicion of hypothyroid, you should treat it aggressively because a baby will be born as a cretin. Got it? And insulin we'll discuss with respect to physio in HPL. Okay, this fine? And also one more thing, as we told, pregnancy is not only about fetus and mother, it's also about father. Why do you think I'm saying about this? See, when it comes to blood vessels, we will take up one more thing, that is, if it's an RH negative pregnancy, then again it's a case of complication. Okay, see how we are deriving each and every aspect of it. Okay, this is something to do with anatomy. Now I'll take up the physiology part of it. Okay, what do you think is this, student? Huh? Yes, you're right, this is placenta. Why is placenta here? Are you getting confused? Yes. See, in physio, remember 2 or 3 things which are very important. One is hormones, one is neurotransmitters, and muscle contraction. If you know this, something of clinical you can manage. Okay. What do you think I'm talking with respect to placenta? Yes, the hormones which are released from placenta. The progesterone is the hormone which is which maintains the pregnancy, which is present by placenta afterwards. What are the other hormones? HPL. So why do you think I am discussing about HPL in this section? Yes, HPL is the thing which is responsible for causing GDM in few patients because it increases the insulin resistance. Why do you think it will increase the insulin resistance? See, the fetus always requires glucose. So if it requires glucose, then insulin should not act. Correct? So what does our body does? It tries to provide glucose by increasing the resistance by producing HPL from the placenta. So when do you think it is maximum? It is maximum of 24 to 26 weeks, and this is the rationale of doing a GTT in our country. See, there are some things to remember. I don't deny it, but even for that there is a reason. Why do you think is the reason? Here HPL is maximum, so there is highest in your 9 months. This is the period where you have highest in insulin resistance. So we will do it in this particular time. Got it? There is nothing to remember. There is nothing to remember. If you know the concept and if you know what you are doing, you will be always right. Okay, fine. So that is one thing which I need to touch upon in physio part. And what do you think is this, guys? As it is written, amniotic fluid. Yes. What do you think I am discussing here? Yes. If it is increased, then it is called polyhydramnios. And if it's decreased, then it's called oligohydramnios. Correct. So these are the things. Especially in physio, there is nothing much to discuss in this chapter. Fine. Yes. Now coming to part. As we discussed in OBS or in gynae, follow the index of Robbins. What do you think in patho? First thing is cell injury, then infection, which can be acute or chronic. Correct, no? Why do you think I am discussing infection here? Torch infection, which is very, very important. Okay. This you should know by heart. I'm not saying you should by heart these things, but if you understand it conceptually, then there's something to do with pregnancy. If this is not treated appropriately or aggressively, or if prevention measures are not taken, then there is a complication to pregnancy. Okay. Then next, what did you add? Yes, genetic and environment. This both influence pregnancies, and genetic abnormalities can be seen if proper pregnancy care is not taken. Got it? Then what do you think are the other pathology? Premalignant, malignant, and benign. As such, pregnancy, if hyper beta HCGs are produced, then ovarian cyst might be common. And also all these gestational trophoblastic neoplasias, which are going to study in subsequent videos, is something which you need to remember from malignant part or benign part, ovarian cyst and GTN. Okay, got it. So now the approach is done. That is our anat physiopatho. Now, yes, coming to investigations. What do you think under investigations which are gonna include? We'll start with basic. What did you study in first year? Anat, physio, and biochem. So biochem. What do you think are the tests which are gonna order? Beta HCG. That is nothing but urine pregnancy test. And also in some cases of gestational trophoblastic disease, this will be elevated. And where do you think it is decreased? S, students. S. Think about it. S. It is in cases of ectopic pregnancies. Okay. Now coming, except that you can test your hormones if you need, but not tested. This is something which you should remember. Next, coming to pathology. If it's a case of abortion, then you will send it for an HPE examination, except that as such there is no role of pathology in this case. Next, coming to microbiology. There is no role as such, but asymptomatic bacteria, that is urine culture, is something which you routinely do. Next, the major part which governs pregnancy is radiological investigation, which is of paramount of significance and which is ruling the investigations in pregnancies. Okay, what are the things you think are the major things in radiological? S, the ultrasound, the 4 scans which you do. Can you remember what are the 4 scans? Yes, first is dating scan, next is NT scan, next is anomaly scan, and growth scan. Correct? So ultrasound is important. Then to monitor the fetus, we do something called as, yes, you're right, non-stress test. Okay, where we check the fetal well-being. Okay, in our subsequent videos we'll understand what it is, but now in an approach you should know what are the investigations which are available, right? That is why I'm talking about this now. So major thing is ultrasound, which governs pregnancy. And also there's something with ultrasound, you can use Doppler. What do you think, where will you use Doppler? We can use it in umbilical artery in cases of checking for any IUGR or FGR. Then you can use middle cerebral artery Doppler in cases of SY. What do you think? Anemia. You are 100% right. Why do you think I am checking MCA in anemia? Because there is got as brain sparing effect. What do you mean by brain sparing effect? Even if there is anemia, the blood is diverted to middle cerebral artery so that the normal structure of brain is maintained. Okay. Then other umbilical artery MCA is something which is important. Also they do something called as ductus venosus, which is again for FGR. Okay. So what are the major things? Ultrasound, Doppler, then NST. NST with uterine contraction is CTG. Okay, got it. Then you check the heart rate, that fetal heart rate is measured. I think now you have a fair idea on what are the investigations which I do. Correct, no? Now what do you think is the next thing? Is pharmacological management. What do you think are the drugs which you should remember? Even if a first year student watches it, they will say iron and folic acid, and if required, calcium and vitamin D. Okay, this part of pharmac is something which you should know. Endocrine part of pharmac, for example, in cases of hypo or hyperthyroid, okay, that is something which you should know. Okay, then NSAIDs and antihistaminics part. Why do you think I am talking about it? As in cases of hyperemesis gravidarum and mild fever, you use this. Okay, then what are the things which you can use? Major thing is iron folic acid, which is given prophylactically to everyone. Okay, everyone. That is something which you should know. Then NSAIDs, antihistamines, endocrine, then other, if there are any pathological thing, you should know to treat. Something which is more important with respect to pharmac in pregnancy is teratogenic drugs. If you don't know this, I'm sure you'll be beyond pass. What is something which is very, very, very important? See, there's a classification of teratogenic drugs A, C, D, X. This you will go back and see, because this is something if I teach, you will just listen and you will forget. If you go and see, then you will remember for a longer time. What do you think is the most common thing which you should ask? Something related to seizure disorder, especially valproate, is something which you should know. Okay. Now, prophylactically giving it is something is also do with prevention, that is under Anemia Mukt Bharat. Okay. Then for safe confinement, you have various schemes. Okay. All this JSSK, JSYK. This part is something to do with community medicine. Okay, done. So this is the proper thing. See, now you have a proper approach. 1 second, let me put it in a box so that you remember for a longer time. Now, if you need to do any surgeries, for the sake of completion, second trimester is something which is very safe. Again, subjected to variability, I am speaking in general. Okay. Now, see. Now, if you see, you have a broader picture of how we have horizontally and vertically integrated each and every pre and paraclinical department in your ops. Okay, this is something which is lacking among us. So now, coming to the revision part of it, see. First, we start what are the structures which were there. The normal HPO axis, if it is proper with the proper endocrine correlation, then it causes pregnancies. And in pregnancies, what are the 3 or 4 things which are important? Blood vessels, fetus, umbilical cord, and placenta. If placenta is not properly attached, then it might lead to placenta accreta spectrum and vasa previa. And if there is a problem in umbilical cord, then it might you might get a case of lateral insertion or velamentous insertion. Then if it's something to do with fetus, if it's not properly attached, then it might cause ectopic pregnancies related to blood vessel. It contains blood, and if hemoglobin is less, then it causes anemia. This is something which every one of a medical student should know. Then if there is resistance, then it will causes pregnancy-induced hypertension. Then a pregnancy as such is a hyperdynamic state. Then so that's why you are predisposed to heart-related issues. Then as I said, pregnancy is something to do with both husband and wife. So there is a complication of RH negative pregnancies. Then coming to physio, as I told, hormones and amniotic fluid less, oligo if it's more, poly and placenta. I talked about HPL and uterus as the index of Robbins and how we extrapolated it. Yes. Next, coming to the investigations, biochemistry is something to do with hormones. Then radiological thing is something which defines the investigations of pregnancy, which is majorly governed by ultrasound and Doppler. And also for fetal monitoring, you do NST and CTG. Okay. Then coming to the pharmacology part, we knew that as a prophylactic and anemia parathyroid, which is a part of community medicine for the prevention of anemia, we give iron and folic acid. Then if there is any conditions of hypo or hypothyroid, we should know something related to endocrine. Then in for complications of pregnancy, as we discussed in previous video, that nausea vomiting is something which is very common. So to prevent that, we should know antihistaminics. Then also NSAIDs for lower abdominal pain. Then the teratogenic drugs, which you will go today itself and see what are the drugs, and this is the classification. Then when is the surgery safe? Okay, this is the broader approach, students. See, if you remember this, no, then now go back and see the index of Datta or index of Williams. Is it not? Now we have covered almost every part of it. Now coming to the complications of it. See, pregnancy is something which is very very vital. Now when it comes to complication, I remember this way. If you find it useful, then you can use it. See, complications of pregnancy. How do you go? It might be a complication to mother, or it can be a complication to fetus. What do you think is a complication? In fetus, multifetal gestation is a complication. One will be macrosomic, one will be microsomic, so it will be a complication. Then you might have preterm labor. Yeah, that is a complication. Then you might have premature rupture of membrane. That is a complication. If it's more more than 4.5 kg, then you say it is a macrosomia baby. Correct, no? This is something to do with fetus. Done. Now coming to mother. Mother as such is two. Only mother or placenta. Under placenta, we discussed abruptio placenta, placenta crater spectrum, antepartum hemorrhage. All these things comes under placenta. Mother alone, you might have complication of abortion, you might have complication of ectopic, also you might have complication of gestational trophoblastic disease. Okay. Now, if you remember this, complication of pregnancy, this is how I remember head to toe. So what do you think? First thing which I think is related to brain. You have all this pregnancy induced hypertension features like headache, vertigo and blurriness. Next year you have thyroid, so you might have thyroid related disease. Here you have liver, you might have liver related problems like HELLP syndrome and stuff. Then here you have insulin, you might have insulin resistance because of increased HPL. You might have GDM. Also the drugs which you give as a drugs, so that can be teratogenic, so you might have problems related to teratogenic. Then also any genitourinary symptoms, for example, she might have abnormal vaginal bleeding or any infection which is prone. Okay, so this is how I remember. Now go back, as I told, go back to the law of Williams, see the index. Now say me if you have not covered all the part, all the diseases of it. Yes, so this is something which you should know. This should be coupled with what? This should be coupled with statistics. Now you know the statistics, now you know the approach, now you know what cases you see, now you know what are the complications. Now it's a perfect time to dive in and study the remaining subject, so that you will understand what is the problem with related to each thing. Got it? This is something which is the basic approach we should know as such to approach obstetrics. I hope things are clear. Have this picture in your mind. Okay, again I'm zooming it. Have this picture in your mind so that you will never forget. Got it? I hope things are clear now. For now, I'm ending this video. In next class we'll see what are the other ways or other things we can use to approach this particular subject. As of now, thank you. Go back and revise about the teratogenic drugs which I have mentioned. Okay, thank you guys.